We have seen cases in the past that have undergone multiple surgeries elsewhere without having the possibility of doing the imaging that would localize those lesions.
The worst case scenario is to do a near total pancreatectomy on a child, leave a portion of the head of the pancreas, and have a focal lesion proved to be within that residual pancreas.
The doctor told us that she would get better in 3 or 5 days. After 2 weeks, the first surgery was scheduled. So then I started to look all over the internet to see if there's another place that could help her. And I found CHOP the day of the surgery. I told her the situation, that my daughter was gonna go in the OR in about half an hour, and she's like, no, don't let that happen. We can help you over here, and there's different tests that we can do that can help your daughter. And so we canceled the operation. The PET scan was considered experimental, and so the state denied us to come. We went with the first surgery. It didn't go well. A week later, we went with a second surgery, and that didn't go well either.
If the lesions are in the head of the pancreas, doing a 98% pancreatectomy would not achieve any good results because those children will continue to have severe hypoglycemia, and now you have removed pancreas that was normal.
She had 3 seizures, and she will have disabilities. We don't know what level of disability she'll fall in, but for our case, if we were here earlier, I think that my daughter would have had a much, much better life.
So the best case scenario for a baby that is born with hyperinsulinism is that the diagnosis is made as early as possible.
We've had the experience of having a family deliver here at our special delivery unit, and we knew ahead of time that the baby had hyperinsulinism.
In most circumstances, that's not the case. In most cases, the diagnosis is made after birth. But for certain populations, such as the Ashkenazi Jews, we know exactly what mutations are more common in that population, so prenatal testing is something that could be done.
My husband and I both are of Eastern European Jewish heritage, and so my regular OB practice just offered us the standard genetic testing panel, which we accepted, really didn't think anything of it. And a couple of weeks later, it came back that I was a carrier for this thing called congenital hyperinsulinism. We were referred immediately to CHOP. And pretty quickly, we met with Dr. Stanley and Dr. Adzik and genetic counselors and maternal fetal medicine people. And they sort of explained to us step by step exactly what we could expect to happen.
As soon as the baby was born, we had an IV in the baby. We were giving the baby sugar through the IV. So that baby never experienced low blood sugar. And that's really, if you knew you were going to have a baby with HI, your goal is for them never to have experienced the low blood sugar. Whether they have focal disease or diffuse disease doesn't matter. The goal is the same.
Early treatment was key because she never had a seizure, because she never had brain damage as a result of a seizure, she has developed normally. Shira is an amazingly fun and sweet and incredibly affectionate kid. She's really very, very special. Pancreatitis.